So we're actually starting the safeguarding and protecting vulnerable individuals unit today. With the role you're doing, you'll probably be very, very well versed in safeguarding anyway, and you'll see that there's a lot of points that you know as it is.
Yeah.
So on here, we're going to look at, there's 4 learning outcomes. We're going to look at learning outcome 1, which is understand the legal framework, regulations and policies and procedures that support the safeguarding and protection of vulnerable individuals. So 1.1 is going to examine the concepts of safeguarding and protection, nice and simple, just telling us what they are. 1.2 is explain the legislative framework for safeguarding vulnerable individuals in health and social care. 1.3, which is a bit of a longer one. It's actually, no, 1.2 is the longest, but analyze how serious case reviews have influenced safeguarding and protection. So we've got a little bit of that there. And 1.4 is explain the action to be taken in the event of suspected or actual abuse. Now, I'd like to point out when we look at 1.3, we're going to be looking at some sensitive information. So I really apologize if there's anything that is upsetting or sensitive, because I know that the safeguarding can be a bit of a touchy issue for a lot of people.
Yeah, no, that's fine.
Okay.
I didn't have to do it on level 3 on baby tea and things like that. So
yeah, so you know the gist of it. I mean, we're not getting into Victoria Climbale Baby P here. We've gone for the Winterbourne case review instead. So it's a little bit more adult-based in this section, but it's the same sort of concept.
I'm familiar with that one as well.
Yeah. There you go. So I'm going to make this bigger slideshow from beginning. So our aim for today is to provide you with a thorough understanding of the legal framework for safeguarding and protecting vulnerable individuals. It'll help you to develop your knowledge and skills, and especially when you're managing staff or trying to develop their understanding in this area.
Yeah.
So nice and simple, you already know the safeguarding is the term that we use in the UK and Ireland, and it shows how the measures that we take to protect the health and well-being and the human rights of individuals, and how safeguarding allows people, especially children and young people, and also vulnerable adults, to live free from abuse, harm and neglect, so they know what their rights are and who they can actually go to if there's a problem. So, as you know, especially as you're working, I'm guessing you're in the adult sector within care, aren't you?
So it's still under the same company. It's just now working with complex needs and special needs.
Yes. So with this, regardless of the age of the person, to be honest, safeguarding we know is an enormous issue. So whether they're children and young people or if they're 18 plus, we've got a duty of care for them. So we need to be there to safeguard them, to help them. So you might have adults that are in safeguarding who are elderly or frail. They might live alone. They might be in care homes. They might need support from family members. They might have mental health issues or physical disabilities or learning disabilities. So a carer will, obviously, they'll try to focus on empowering that person. They'll try to protect them and prevent them, and also put proportionate responses in place. You might have partnerships, like we did about a partnership unit, working together to safeguard people and to help them. And then you'll also have an accountability to safeguard these vulnerable adults. When you're working with anyone, you know, you'll even after a couple of weeks, you'll understand what changes they have. You'll be able to recognize a lot of things about them. So it really goes towards you helping them.
Yeah.
Protection is just a central part of safeguarding, and it just promotes welfare. So it's the process of when you're protecting individuals, so they might be identified as being at risk or suffering risk, or they might be a cause of significant harm because they've been as a result of abuse or neglect. Now, protection also encompasses all the activities that you do to make sure that they get the full respect for the rights of their individual, so that you're following the human rights of law, that you're following international humanitarian law. So whatever they are, regardless of where they're based, that they've got basic needs like food, shelter, hot water, be able to wash themselves, so they have those needs there.
Yeah.
And that's it. So that was just one is safeguarding. Nice and simple when you do your essay. Explain what safeguarding is, explain what protection is, and you can also include a mini example in both.
Yeah.
So 1.2, got my bar in the way there. So explain the legislative framework for safeguarding vulnerable individuals in health and social care. This is about 11 slides long, so it's a bit. So legislations, we know they're there to help us know exactly what we need to do, so we can follow a set of rules and procedures in our practices every single day. If they're not there, if your place has not put in place an implementation of these policies and procedures according to legislations, we'll just be walking around blindly doing whatever the heck we feel like. So they're very important. So we've got the Care Act, and you'll have gone through this anyway previously. So it's an independent advocate. So the Care Act aims to strengthen the voice of people who use their services, and also their carers, and they also process the assessment, planning, and safeguarding of these people that use their services.
Yeah.
And then local authorities are there they've commissioned them to be independent, so they're an advocacy service, and they help to support people where they need it.
Yeah.
So under this act, local authorities need to arrange an independent advocate to facilitate the involvement of a person in their assessment. So somebody independent will come in and review the case, sort out a support plan, just to make sure that they're getting what they need. Now, this will only happen if the person has substantial difficulty in being fully involved in the process, or if there's no other appropriate support available, somebody who can respond or represent the person's wishes. So those are the two cases where it will happen.
Yeah.
Now, the Care Act, just an overview, it helps for duties within adults, because we're talking more about adults in this section here. So you got to make a cause to be, so you got to have inquiries to be made if a person is at risk, or if they're being neglected or they can't protect themselves. It helps you to get no emergency and compulsory powers. You've got this, the SAB statutory safeguarding boards as well on here. Got a serious case review, so in case there's something serious has happened, there's been a death or a serious accident. And then the safeguarding adults board, they will actually, the SAEB, they might request a person to supply information to it, or to they might say, can you give us information, or can you give another person information? So this is a gist of what the safeguarding adult, the duties are covered in here. And then we got our health, our care, our say. Now, in 2006, a white paper was created, and a lot of things were created on this white paper. And part of it is our health, our care, our say. And it just sets a nice, new, refreshing way to look at the social and healthcare system. It aims to promote independence, well-being, and choice, and it helps to improve your service experience. Now, this link, I've started putting links into the slides where you can, because there's some things that I see and I like the information they've got. So if you get a moment, click on this link. It's just a nice detailed information about what we're going through, and it's very nice and easy to read as well. So in a nutshell of what I've got on that link is their vision is to put people more in control of their healthcare. They want people in control. They want them to have more effective care, and they feel that if they've got evidence supporting that when the person feels that they're in control, their care is more effective. Yep, enabling and supporting health and independence and well-being. You've got a rapid and convenient access to high quality and cost-effective care. So, you know, everybody should have access to services. It doesn't matter where they live or what they fit at. Your services should fit in with their convenience, is what it means.
Yeah.
And also it means that services should serve people better if they're placed in local communities, you know, so that they're more accessible and more comfortable being able to go to them. Then we've got putting people first, 2007. So, social care and care work is undergoing major changes, and it's consistently changing and adapting. So there's a lot of things that are coming into place. Now, there are quite a few reasons for this being put into place. Is looking at the increasing and changing needs to what the demands are at the moment. It's looking at people's expectations and how they've changed, and just to direct in that sort of example, to be honest. And also they're reflecting on what the evidence is about what works for people, and they're trying to go towards that direction as well. And then putting people first is a national agreement, and it's setting out what the future direction will be for adult social care services. They've got some ideas that will underpin policies and changes, and these are, again, they've got our health, our care, our say. That's part of it. So it sets out a vision of what good quality social care is. And then they've got putting people first. This is a national agreement which set out the direction of the reform. So under this banner, they've got both our health, our care, our say, and putting people first. And then some ideas that underpin the policies and proposed changes here. We've got social capital. Now, this is just a la-di-da type of term that you want to be able to develop your community to help them get all the resources that they need for their care. So that they're being supported in the way they can, and also their family and friends, their network is being supported as well. Then you've got universal services. So it's just another way of saying that social care for adults needs to be able to support all the support that you need for them and also their carers. So, for example, if you're going into a hospital, if you're going to a care home, or you're going into an area where you need some treatments done, there should be clear signposting, there should be accessible, there should be a whole load of services that are available. So you get rid of confusion. And these will include transport, getting leisure activities, and just trained in certain aspects that you might need, which a family member might need to help.
So in that, when I conclude that, can I involve like the DOLE, CPS, advocacy, start with that, things like that?
100%, yes, because it all falls under the same banner.
Yep.
And then you've got prevention and early intervention. Now, this actually I think is key, especially with you working with people closely. You're going to notice this. You're going to see changes in them. You're going to see what sort of risk or things. I mean, I worked in schools for many years, and there were certain things that I picked up on because you get to know somebody in a day in, day out basis. So again, it really does work towards there. So it helps you to maintain good health and independence, and you're sort of getting a low level of support because you're noticing it earlier. You're identifying people at risk. So somebody might be losing their independence, they might have financial aid taken off them, they might be neglected, not having the right type of clothing, so you will notice it. And then also you'll be able to help people get back on their feet after an illness, so they're not going to fall through the cracks. So they've come in, they've had to stay, then they've gone out, where they're going to. You need to know, have they got a good support network or not?
Yeah.
And then exactly. Because there's no point in you caring for them just to put them back out and then they've not got a good support network, or they've got nowhere to stay. They can't manage it then. And then the final section on this one is choice and control. So if you're giving people a greater choice and more control over their care, their daily life, so we can also call this self-directed support or personalization, it will actually help you to adapt new ideas and new techniques and just assist them in the way they need. Now, choice and control is very similar to person-centered care, because that's all about the person saying, this is what I want, and you personalizing their care in that way. So it's very, very similar in that case. So that's 1.2.
Yeah.
Now, onto case reviews on this section here now.
So
what is a serious case review? To be honest, you already know this, but I put this down just in case it's just to put it down. So we know that case reviews happen if something major has happened, if there's been a death or an injury or abuse or neglect. So that's why I say case reviews happen. To be honest, then on the previous day, like you mentioned in Baby P and Victoria Climbay, all of those, they happened too late. And it has really shown and advocated the way care is being handled now. And that is why we've got multidisciplinary and partnership. And they're carried out by the safeguarding boards so that we can learn lessons and adapt from there. So they carried out, like we said, by the... do you know what? It's the second time I've done this. Put the same thing down. I'll get rid of that. So every 2 years, an overview is done of these reviews, and they just sort of like try to find out what sort of themes and trends are going on. Have we actually learned our lessons? Have we adapted from this? Or are we still making the same mistakes? So we can change our policies, change our practice, and even change certain ways that we do our procedures at work as well. So it really does inform you on what you need to do. And then coming on to the Winterbourne View hospital abuse case. Now, in this, like you said, you're familiar with this, but this is just to recap. So there were adults that had learning disabilities and autism living at Winterbourne. And they were really, it's quite upsetting, but they were subjected to abuse by members of staff. And it wasn't even unwitting abuse where you unwittingly neglect someone or forget to give them something. It's deliberate abuse that was happening. So most of these adults that were there were detained under the Mental Health Act of 1983. Now, Terry Bryan, he was a nurse actually there, and he viewed his concerns. And now, even though he viewed his concerns, they were completely ignored. Nobody paid attention to them. It's only when he went to a reporter and the reporter did an undercover investigation and brought things to light that it was taken seriously. So it's even now, when you go and put down your concerns, you will get taken seriously. It will get, under the safeguarding board, it has to be reviewed. But at that time, things were, exactly. So at that time, patients were being assaulted, they were being harshly restrained, given cold showers, put out in the cold, they were getting their eyes poked, or, you know, deliberately doing things or pulling hair and forcing medication. Now, I have a nephew who has autism, and I find it quite upsetting to understand that somebody with the mental capacity in the way that they might not understand certain things, they're not going to understand there's a load of different levels of this that happens within your understanding. So you can't generally expect them to have the same understanding on the same level of development that maybe me and you will have, where you'll give me an instruction and I can follow it. You have to be more patient. You have to take your time. And it's when you're thinking about a vulnerable person already in a state where they might be confused and not know what's going on, having treatment like this, it's just horrible, to be honest. Now, even though his concerns weren't ignored, like I said, he went to that reporter and it was done. So all the evidence that was collected by that undercover reporter, he sent to South Gloucestershire Council, and they were then duty-bound to hold a serious case review. And they enabled it, they found it, and they closed that service down. They got everything sorted. And luckily, it was pointed out, but it only happened because somebody made a report. So it's very important that when you see something happening, you report it, even if you think it's unsubstantial. I mean, there's things that, as working in education, I've seen that have turned out to be unsubstantiated, or has just turned out to be somebody saying something, especially if you have a child coming and talking to you. But it's your duty, even if it turns out to be wrong. I'd rather be wrong. And I won't feel embarrassed about it either. At least I was caring enough to make a report. Exactly. Rather than think, I've got a bad feeling, but this person's my friend, or if we work together, it might make a bad situation. It's not helping anyone.
No.
So what went wrong in this case? So we had a lack of accountability. So Castlebeck, the people who were responsible for the running, they didn't give enough sufficient service. They didn't have any accountability of what was being run. They weren't really managing it well. So people were just left to do whatever they wanted to do.
Yeah.
There was a neglect to check the suitability of services. So the patients that were there, were the staff actually trained to do that type of job?
Mm-hmm.
Now, I remember my very first job that I did. I was fresh off the boat, and I went and did a one-to-one teaching job where I was looking after a young child who'd had a serious accident. He'd had some behavioural issues before his accident, but they were exacerbated because of his brain injury. Now, I went in and I did that, and a couple of weeks into it, I ended up getting kicked and knocked about by him, which it was only a 9-year-old child. He got frustrated. I didn't know how to handle him at that time. I didn't know what his triggers were. So was I the right person for that job? No, I wasn't at that time because I had no clue what was going on. Yeah. But if I was to go in now, because I've got a whole many years of experience now, I'd be able to manage things a lot better. And, so it really depends. The people that you're hiring, are they actually suitable for what you're asking them to do?
Yeah.
Then you've got lack of efficient record keeping. So patients will be there, they're getting accidents, some patients were getting injured because of the treatment, they're getting taken into the hospital. Now, they recorded 78 times that patients were taken into the hospital, but the hospital didn't record the number, they didn't check the attendances in such a short period of time. If they had, they would have wondered, why is it just this care home that I'm getting so many patients from? So a whole load of things just going wrong and not working together. Which, to be honest, we see in every single case that you see, which is a serious case review. It's always where there's lack of things just falling through the cracks. You're not marking it, you're not talking to each other. It's all communication.
Yeah.
Then we've got lack of justification for action. So we know Primary Care Trust, have said that extensive physical restraints and sedatives can't be used without justification. But who's managing this? Who's saying this?
Yeah.
You got the poor safeguarding system. So we know that even though there were alerts that were being done, then no action is being taken. So like Terry put these voices concerns down, but they were ignored because nobody's bothered.
Yeah.
They didn't respond to any reports, so the CQC failed to respond to any reports made by Terry Brown, which I find extremely surprising, to be honest, that they failed to respond to it. But exactly. So I'm glad that I think these type of cases have actually led them to be to the entity that they are now as well.
Yeah.
And then lack of belief of complaints. I mean, patients are complaining to their families, but if they're already viewed in a certain way, they're saying that you're detained here, they're probably just trying to get out of here by making things up. So there's that issue that's going on where you're like, oh yeah, he's probably making up, or you're voicing a concern like my sister is saying this or my brother is saying this, and you'll be like, oh no, they're just making up because they don't want to be here, they're just laying it on in front of you. So
yeah,
you know the way it works. And then we look at the Francis review now. So this just looks at how hospitals have responded to the findings. So this was done by Robert Francis. He made a report, and they just put down like sort of themes and things that should be looked at. So his was including the importance of openness, getting good staffing levels, and have a patient-centered culture. And it really has a good deep meaning with the management within hospital now, because they find that this works.
Yeah.
So he did this on the 6th of February, and he looked at the failings in care at the Mid Staffordshire NHS Foundation between 2005 and 2009, and he made 290 recommendations. I'm not putting them all here, just a couple. He said openness, transparency, and candor, like we've established, communication is really important. Mm-hmm. Be compassionate, give support, be caring. Now, these are all within our care values as well now, so it's nice to see that they've been reflected in how things are going.
Yeah.
Then the freedom to speak up. People don't speak up because they think that things are viewed as whistleblowing. I'm going to be seen as a snitch or a tattletale. You know, from when we're younger, if you tell I'm not going to be your friend, that type of thing.
Yeah.
So we have preconceived notions anyway about what we should and shouldn't do. But it's not tattletaling. You have the freedom to speak up. Make sure you do when you need to.
Yeah.
And then the final section on this, the government responded to the recommendations in an inquiry called the Hard Truths, the Journey to Putting Patients First. So it's got recommendations in there to improve patient involvement in the care, how transparency can be done, what sort of changes need to be done to regulation and to inspection as well. So I've got a link for the Francis Review in the references. I'll point that out to you if you want to have a look.
Lovely, thank you.
So that was 1.3. And then the final section, which is a nice short one, explain the action to be taken in the event of suspected or actual abuse. So you're in the front line. You're working within management, but you're also working on the floor as well. So you know what sort of contacts you have with care individuals and also patients. You'll get the knowledge about them. You'll be familiar with them. You might end up knowing their family members. And, in a way, you're in the best position to spot any signs, or especially if you've got long-term patients that are with you or that you're looking after on a daily basis. So you'll probably be the first person to notice it, yeah. So if you find out that abuse is taking place, take charge, look at the individual's behavior, look at their personality. You'll know something's different or not, and then report it. So reporting in itself can be a bit vicious. Sometimes you're unsure of what to do, who to go, especially if you're new in your company or if you're a bit green about the ears, you don't want to rock the boat. So you just think, oh, how can I do this? But just follow you'll know yourself. You've got protocols and procedures. Now, whatever setting that I've worked in, I always used to have, there was a very nice, simple image, like an organogram, just sort of like showing the hierarchy of who is responsible for what. They'd have a picture of the person, the name, and then the title underneath. And it'd tell you, this is the person you go to if you want this. Nice, simple, easy to use. If you don't know the name, you can recognize them by face. It's very easy to use. Yeah. So you might, I'm not sure if you've noticed anything, that it would be on like a management store where it would say, head teacher, safeguarding lead, and then they'll have safeguarding liaison officers underneath, and then how to get in touch with them, what their numbers are, and their pictures as well.
Yeah.
So if you think abuse is going on or something has happened and you just want to get it checked out, report all the facts immediately to your appropriate person. So it might be a management, you might be the person that's in charge. You might need to escalate it and talk to the police or the social services. Make notes and written reports about your facts. If you've had a disclosure given to you, make sure that you're putting down their facts. You're not actually putting down leading questions. Oh, so did he hit you or did she do this to you? You've got to let them lead. And if they stop, you need to let them stop. Listen to the individuals. It might be something that you're not comfortable with listening to. It might be something that you don't agree with, or you may or may not think that, oh, our opinions get in our way, to be honest. So don't make any judgments.
Yeah.
And make sure that the individual is in a safe environment. So I've had it before where I've had disclosures made to me by young children, and when I've gone to try and move them into a safer environment, they've stopped, completely clammed up because the moment's gone. So it really depends. If you think that that person is not going to speak up if you move into a quiet room or an office, if they think it's too formal, then you might have to stay where you are. So use your own judgment. Confidentiality is important, so make sure it's confidential as much as possible. If you're in an area, maybe you can move other people away as well, or signal to staff to get them out of the way.
Mm-hmm.
Make sure you've got consent where necessary. Now, there's certain cases where you don't need consent for making a disclosure, but then certain things you might need a consent for it. So it really depends on what situation it is. And then just as a definition, consent for the purposes of confidentiality means that the service user understands and does not object to how the information will be used. And then also for the consent to be valid, it has to be voluntary and informed. So they need to know what they're giving consent to. So they also need to have the capacity to make that decision as well. And then finally, just don't share the information with someone who doesn't need to know it. It's sometimes you get so worried and you just really want to talk to someone that you probably unconsciously end up doing it anyway. But it's good practice to try and not do that, and only talk to, if you're concerned, go and talk to the person you reported it to. They'll be able to do that for you. And again, another link here, which is quite a nice, refreshing read that I found. It was nice, simple based. It's just sort of actions to take if abuse is harmed or disclosed to you. And much of it will be similar to what I've written down in here anyway. So that was it. We looked at the concept of safeguarding and protection, legislations, looked at a couple of serious case reviews and how they've informed our practice now, and what you should do if you think abuse is happening. And just to refer you back to the spec sheet, scroll further down onto Learning Outcome 1, and it just goes through what you need to go over. So the top big section here is for 1.1 and 1.2, and 1.3 and 1.4 for the other two. I'll turn this recording off.